Bespoke Concierge MD was born out of a desire to do better and to do more with the tools we have available today. We are a holistic wellness practice that marries the best of primary care and functional medicine using really very awesome precision medical tools combined with a lot of time, focus, and energy dedicated towards helping patients really achieve things that they didn't even think was possible. And so that's the roadmap we laid out for patients, and we want to be your trusted partner on that journey.
There's a trend of direct primary care and concierge medicine that isn't necessarily new. It's been kind of growing over the last few years, I'd say, right? But I think maybe to an unsatisfactory point, at least till now. So, or something that we could build on, right? I think you have patients out there and doctors who are frustrated with the system. Direct primary care addresses some of those concerns by both parties, but we wanted to take it a level further, right? We didn't want to just rest on our laurels and see what was going on. We kind of felt like we had more to add to that, particularly from the patient's and the client's perspective. They are deeply unhappy with the current healthcare system, right? Now, we're not going to change the healthcare system, and we know that.
Yeah.
But we have something to add for these clients and patients, right? And one is access, one is good communication, which patients are very disappointed at the whole medical care system about lack of communication. We hear about it all the time.
Yeah.
Or waiting for primary care doctors and having nobody to see in their communities. So, we want better access, we want good communication, and bringing a telehealth perspective to that with technology. Because I don't want to just serve the people in the community around me, but why not go broader? Why not serve people in the rural communities everywhere in all 50 states, right? Why limit ourselves?
They're all Americans, right? They don't have to just live in a big city. Everybody in America deserves that right to have access to the healthcare.
And I would add, on the same point, not isn't just the clients that we feel like we can help, but we can also help other doctors. Doctors don't like the system either, and they're frustrated, right? So why not build a system where the clients and the patient benefits, but also make a system where we can bring on other providers, other doctors, other disciplines that allow them to express their passion to really help the patient and the client. Yeah, I think all people have real problems and real goals. And we're there to get you there, right? So we're not going to be dismissive. We're going to build a relationship to sort of solve your problems, and then a relationship to get you to your goals, right? It's great that you have no problems now, but most people have goals, and we're going to get you there. And if you do have problems, we'll take care of your problems first, and then we'll move on from there, right? So that's part of our personalization that we bring, but also encapsulating, like we talked about before, the access, the relationship, the trust, right? And we build on that.
I'd like to make sure people understand they shouldn't have to have a doctor be in the family, whether they're married to it like our wives or their father's a doctor or something like that. I don't think they should have to have a doctor in the family to receive this level of care. In the end, we're very passionate about our families and supporting those families. And the best way we can do that is by being present and having time. And we want to help people invest in their health and give them their time back. So they're not worried trying to figure out how the healthcare system works, or trying to figure out what the next thing they're supposed to do, or trying to decipher what the right food is. This is good for me today, tomorrow it's bad for me, I don't really understand what I'm supposed to do. We don't want people caught up in that. That's our wheelhouse. We'll figure it out, and we'll help guide you so that you can put your time back into your families, and everybody wins.
Access is one of our key components, right? So round-the-clock care, round-the-clock access to where you can call and contact our team, because you can get sick at any time of the day, right? Therefore, you need to be helped at any time of the day. And that's what we're there for. And when you contact a member of our team, they'll have a support behind them, right? So you never should feel like, you can't get in contact with anyone or you're just lost, right? That we have your back at all times.
We also have patients that travel extensively, not just within the US, right? We're in 3 different time zones here, but they'll go to Hawaii, now we're 6 time zones away, or they'll go to Italy, or they'll go somewhere else. And they don't want to be in a situation where, because they left the state, they left their doctor behind. And we always thought that was kind of odd. One of our patients is a good friend of mine. He traveled to Spain recently and got food poisoning within 12 hours of getting on the ground for a fantastic vacation. And so the team rallied around him. We found some local IV hydration services to rehydrate him because he clearly had food poisoning. We sent him with meds for his travel medicine kit. So he had meds with him, but none of them were appropriate. It was just a matter of getting fluids. And so we basically remotely, handheld him for those 2 to 3 days, and it salvaged his vacation that he was very excited to go on with his wife. So we got a thank you card from his wife for that.
And that type of access is great because you treated and helped his problem. But even if you didn't have a problem and you were traveling on the other side of the world, it gives you peace of mind, knowing that we are there for you, right?
That's the real insurance.
Yeah. Life outside medicine exists for both of us, and we've shared that with our families. So that was sort of a common denominator, I'd say. And then, I've always recognized his strengths that I don't have, and I've always told him he is a master at doing multiple tasks at the same time, right? He's the best multitasker I've ever seen, right? And he's got a fabulous mind for business and entrepreneurship, right? And he's constantly just thinking of new ideas and not just resting on or just thinking about them and moving on. He'll implement them, right? He'll put something into plan. Where lots of people will just think about it, and then where does it end up? It ends up nowhere, right? But that's not him, right? He'll think of an idea and then pass it along to someone else and work on it and work on multiple ideas at the same time. Very difficult to do, but he pulls it off, right?
One of the first things I learned from Mike is actually trust. Trust that I don't have to be perfect. Trust that I don't have to catch every mistake. Trust that I don't have to be, the only one standing guard trying to protect somebody's health. And he really taught me about teamwork in residency because I think he took pity on me on some level because I was struggling so much that first few weeks. But he mentored me and he mentored everybody. But he really, he took pains to make sure that I was, standing upright to support those patients. And I really appreciated that. And it gave me confidence to dig a little deeper, try a little harder, work a little faster to help support the healthcare. He taught me also the value of teamwork, which we've implemented on basically everything we've done. And so I think it's, it was great. There's nobody I would rather partner with, frankly, than Dr. Edney to do these types of things because I know he's that person that will always put his hand on the back and be like, hey man, we got this, let's go. No, but he has been my mentor as a physician because he got a hold of me early and really reinforced something my brother tried teaching me, which is about being thorough on behalf of the patient. Not being thorough because of your own curiosity, which we both share intensely, but doing it because if that's somebody's mother or their sister or their son, there's a level of obligation you have. It's servant leadership at its core. He doesn't talk about it, but that's unequivocally something he really strives to display, and he does. He leads first. He goes in, he takes care of people, he suborns whatever he needs, whether it's food, sleep, whatever, to support the outcome. And it really had such an impression on me as a resident, and he really reinforced my inner ideals to do that. But when the rubber meets the road, a lot of people go, I don't need to study this. Somebody else will take care of this. That's a really common thing you see when people are overworked and fatigued or just not interested. And so he really taught me to push forward. Another thing I think he does really well, which is why he's a chief medical officer, is that I have never, ever met a person who builds a better healthcare system. And I didn't even say a better system. He was a professional chef before he became a registered dietitian, before he became a primary care doctor, and a great one at each of these jobs. It was amazing talking to previous employers and previous coworkers. It didn't matter what system he was in, he found ways to improve it and make it faster and better. And for everybody, from the chef who was cooking the food to the patron who was eating the food, everybody was happier when he was involved in building those systems, which is why I was so excited when he said yes to be the chief medical officer and co-found this with me. It gave us a situation where if we just bring our best talents together, everybody hopefully will win.
Better together.
Yes, cheers.
Thank you.